We get into a conversation this hour that essentially has formed part of rumblings and chatter over the last couple of days, and we'll do that this morning with Maryline Limo. She's already in the hot seat of the Situation Room, and she is the Vice President of Operations at the Mediheal group of hospitals in Eldoret. Maryline, good morning.
Good morning to you.
Karibu Sana.
Thank you, Santa.
This is the Situation Room, and you're in the hot seat of the Situation Room.
Yeah.
So, Karibu, and let's welcome you, first of all, to this show. CT goes around the African continent every week. He comes back with a proverb from a different country, and he wants to share that proverb with you this morning. And then we'd like to get your interpretation of that before we get into the conversation. All right? Okay.
The proverb: do not be like the mosquito which bites the owner of the house.
He'll be fine. All right.
Now, let me give you a disclaimer.
Mm-hmm.
You cannot be wrong.
Okay.
Whatever you say will be your interpretation. In fact, the beauty of proverbs is that you can interpret it the way you like.
Yeah.
Yes.
Okay.
Mm-hmm.
Yes, so
there's no right or wrong answer.
No, even if you try, you can't be wrong.
Okay.
Yes.
Yeah. Okay, fine, thank you.
Okay, so tell me, what do you think we're saying what do you think we mean when we're saying, do not be like the mosquito which bites the owner of the house?
What I think is, do not betray the person who have given you shelter.
There you go.
Yeah.
There you go. Easy to do, isn't it? Right.
It's simple, straightforward. Yes.
Okay. All right, let's get into this. Looking at different things that have happened over the last couple of weeks, actually, and then a little more so into the last couple of days. And I want to start off with you telling us what the Mediheal group of hospitals does. What are you involved with?
Thank you so much. Mediheal group of hospitals started in 2004. Started their journey in 2004. It's a group of hospital with 12 branches. The multi-specialists with neuro and spine surgeries. That's brain and spine surgeries, which we have done more than 5,000 successful procedures.
Okay.
Intravitreal fertilization. We have done more than 10,000 procedures. Kidney transplant. We have done more than 400 successful kidney transplant so far. Again, pain management, which we have successfully done procedures more than 3,000 in the group. We are also dealing with orthopedic surgeon. That is reconstruction and joint replacement.
Okay, orthopedic surgery.
Yes, that's orthopedic surgery. So, Mediheal group of hospital is a big facility. We offer primary and secondary and tertiary services. The main branch is Eldoret branch, where we have all the facilities. We also do children clinics. Yeah.
Okay.
Yeah.
All right. So how long have you been in existence? How long has the hospital been here?
More than 21 years old.
21 years?
Yes.
Okay. So these activities that you talk about, you've been involved in these activities for the span of the 21 years that you've been in business, from orthopedic surgery to kidney transplants to successful IVFs. These activities you've carried on over the last 21 years?
Yes, we have for over 21 years. Mediheal group of hospitals started in 2004 with women wellness, actually. So as a fertility center. Okay. And then over a period of time, more than now that 20 years in healthcare industry, it has gone to this high level.
Okay.
Yeah.
All right. So, taking all of those things into consideration, and as we get into the story of things that we've seen, with what you've said that the hospital does and how long it's been in operation, the CS, the Ministry of Health, yesterday then gave a directive that an audit needs to be done of the Mediheal group of hospitals, and that it needed to look into that and other transplant facilities countrywide following an expose on organ trafficking. And this was then going into the need for the development of guidelines to curb unethical practices. This came from the office of the CS yesterday. Why would he make such a directive?
Thank you so much. I would like to say that we are facing some challenges and allegations from international press. Actually, we got an allegation that there's transplant which are done, not procedural. But what I would like to tell you this morning is Mediheal group of hospital wishes to categorize and state that all transplant procedures carried out at the facilities strictly adhere to the legal and the procedures of the hospital. We will also like to make absolutely clear that the patients are coming with their own donors to the facility. The facility is not involved in sourcing and selection of donors to the facility. So the clients come themselves to the hospital and the procedures are being followed accordingly.
Okay.
So again, it was also alleged that the facility are taking money from the donor. I will also further like to state that all the procedures are followed and the formal affidavits are signed by the donor, where there's no financial inducement.
Okay.
Yeah.
All right. Maryline, let's take this step by step, shall we? And just talk to us about how these procedures actually happen. For us to get an understanding of then where these allegations have come from, give us a step-by-step procedure of what happens when, for example, a transplant is taking place at Mediheal. How do you start? What is done? What is the procedure?
Thank you so much. Our patients come from local Kenya and international patients.
Okay.
So to be categorical, we have those patients who come directly to our facility through outpatient. So they go through the physician, investigation are made. So if this patient is having a renal problem, the patient will be referred to the nephrologist. So the nephrologist will do investigation that is from outpatient. The patient will do his investigation. If he's having the kidney failure, the counseling will be done to this client, and he'll be requested. We start to bring the possible donor, the willing donor. Yes.
Okay.
And if we also get patients who are referred from other facilities directly to the nephrology clinic.
Okay.
So we have the doctor there, so they come direct to the clinic.
So these patients who present themselves to hospital, whether it is through outpatient or inpatient, are unwell.
Yes.
They are unwell. And so what is happening is a normal transplant procedure that would happen anywhere. Is this what you're saying?
Sorry?
A normal transplant situation that would happen anywhere because a patient is unwell. Is that what happens?
Yes.
Okay. Where have the allegations of payment then for organs come from?
Thank you so much. I would like to state that Mediheal Hospital is not part and parcel of this money. The money which the facility receives are the services which are rendered to the client. So this issue of money has been exchanged with Mediheal. They are not part and parcel of it, actually. That's what I can firmly tell you.
So let me ask a question. Up to date, how many kidney transplants have you conducted at Mediheal to date?
To date. More than 450.
The ministry says 372. And from that, it is from, you say, local and international patients or clients who would come to you. But there is a case of lack of proper documentation in terms of the relationship between the hospital, the donors, and the recipients. Is that the case? Because it is the basis upon which the ministry, or rather the health ministry, is investigating Mediheal. Because there are reports that even some of the HLA tests that are taking place in India have been done against the requisite provisions available in the law. Would you refute that, or where do you stand with these allegations being put by the ministry?
Thank you so much. We have not actually received the formal communication from the ministry. I think that is today's press, which we will get back to the ministry with the clinical team and board of management. But I would like to tell you that we stand, and I can confirm to the public and you that all the proper documentation are being taken. Starting from outpatient to the discharge of the patient. Consent will be signed by the patient. The affidavit have been taken. We also take a video conversation with the client before the procedure with this consent. Yes.
There is a young man who was interviewed in that expose who clearly says that he came to your facility. He came there and he was promised 600,000. After the procedure, he was given 400,000. How would you respond to those claims that have been given by a patient who's directly pointing fingers towards the institution?
Thank you so much. Yes, we have heard it, but I cannot. I'm not very sure, and I don't know actually. The facility are not aware how the money was exchanged.
If the money was exchanged.
If the money was exchanged.
Did this young man come to Mediheal for a procedure?
Yes.
What were the details of this procedure?
The details of his procedure. This patient came with this recipient. They came together directly to the outpatient.
Okay.
So normal procedure and protocols were followed, even the legal.
Okay.
Yeah.
Let's start. Before somebody even comes to the hospital in need of that procedure, and before they come with the donor, are there not tests that are done to determine whether this particular donor and the organ they plan to donate will be, what's the word that we use?
Compatible
with the patient?
Yes, we do.
So we are saying, therefore, that this particular case, this process and others that are needed were taken before they came to the hospital.
Yes, they were.
And they were given notice ahead of time, and they knew the day on which they would come to the hospital.
Yes.
So then the hospital was aware of what was going on?
Yes, it was like any other normal patient.
Okay.
Yeah, the patient was like any other patient that we have served, these 450 patients.
Okay, let's not confuse ourselves here, Mary.
Yes.
Let's be very clear.
Thank you.
You've mentioned just a few minutes ago that this gentleman who is in this story by Deutsche Welle, which is a story that was done, right? That's not a secret. He said that his kidney was removed with his consent, and that there was money that was paid to him. However, the amount that he was promised pre-procedure is not the amount of money that he was given post-procedure. But you've just said that he came with his recipient. How would he know who a compatible recipient would be if he had not had a prior conversation or activity or engagement with the hospital? I can't just show up at hospital with Dennis and say, well, I want to give my kidney, and Dennis looks like the right person to get it. So what exactly would have happened for him to then be in a place where he then does come
with
his recipient?
I think you didn't get me right or clear. So I'll put it this way. This patient, what I can tell you, I'll not have that much detail about this patient, but the patient came like any other patient to our facility. So when the patient comes, we have many patients who come to our facility. When we saw this allegation, that is when I went to check the file with the team to understand how he came, and so it was normal like any other client. So cross match was done, and they were compatible.
So why would he be given money?
We are not aware about this monetary part. The facility is not involved about that part of money. Yes.
What I want to ask is, when this particular story came out, was the hospital contacted by Deutsche Welle? Did that German media house contact you to ask you about what it is that they aired?
Thank you so much. Yes. They didn't, I can say they didn't actually contact, but they tried contacting our chairman who was outside the country.
They tried contacting the chairman.
Yeah, but at that particular time, he had lost his father. So he was not in the country. So he was not even reachable. So they went ahead and did their story. So we just saw it in the media.
So there is also...
Hold it. So there's nobody else who is in the structure of administration and leadership within the hospital who Doshavela talked with or spoke with.
Okay, thank you. I was called myself to the facility when they were taking photos.
Okay. So Doshavela had people who work for them who came to the hospital.
Yeah, and took photos.
Okay, so they physically came and they were taking photos. Had they sought permission to take photos?
No.
If they were to seek permission, who would they have sought permission from?
From administration.
Administration?
Yes.
Who in administration? The head? Okay, your administrative structure.
One, it was, the chairman and the director and the vice president is me.
Yes.
But all these people were not formally communicated.
So they did not formally communicate with any of you? They didn't write to you in advance to tell you they were coming?
No.
So you didn't know that they were coming?
Yeah.
And so you were called that they were taking
photos. So then I requested them we sit, we discuss what is it actually.
Oh, you actually asked them to sit?
I requested them.
Oh.
So and then I requested them, let the chairman come from outside the country, then you can have a discussion, then you'll be able to answer your questionnaires.
Yes.
That is how we left each other.
I think let's leave the matter of Doshavela aside. But
thank you.
What the ministry says is they received a letter from Transplantation Society dated 20th 2023 with concerns over increased Israeli nationals receiving kidney transplants in Kenya. A simple question would be, how many Israelis have you done the procedure for in the country? Just a number. We're not asking in terms of who they are. And as well as the kidney transplants involving trafficked foreign kidney donors had taken place specifically at your hospital. Is it true?
It's true, 18 patients.
18 patients from Israel?
Yes.
Followed the law?
Yes.
You have documentation to show that?
Yeah, we have the documentation. They came with a medical visa.
Why would that be highlighted as a concern by the ministry?
I'm not very sure why it has been highlighted, but if the investigation is done, our offices are open, we can provide the documentation, no problem and no issue with that.
What procedures were done for them?
Sorry?
What procedures were done for these 18?
For the 18 patients?
Yes.
Yeah, they came with the medical visa after the investigation have been done with their own doctor, nephrologist there, and then the patient was referred to our facility.
What procedure was done
kidney transplant.
For them? So kidney transplants were done for these 18 Israeli nationals.
A period of more than 5 years.
5 years, but there've been 18 of them.
Yeah.
The question is, why did they have Mediheal specifically as the institution where they were going to come and have these transplants done? That's one part. And were they recipients only? The 18 who came to Mediheal to have these procedures done, were they recipients of organs?
Okay, thank you so much. For your information, Mediheal Group of Hospital have become a tourism in health. So not only Israel patients are coming from Uganda, Tanzania, Burundi, among now Israelis. We have received also patients from UK.
Okay.
So it's more than 10 countries I can mention. Thank you. But let me address this one for Israel. The Israel patient came with their medical visa. They were referred by their nephrologist from their country to our facility. And normal procedures were being followed. They came with their donors.
Were they recipients?
Yes.
All of the patients who came were recipients. And where were the organ donations coming from?
I'm saying the recipient came with their donors.
Why would a recipient and a donor come from
After
Israel
the investigation
to
have been done there, then they came here. After the cross-match was done there. Yes.
They came to Kenya with their donor?
With their donor. And then another cross-match was done again by Mediheal.
Okay.
Yes.
This is my question, and it's very simple.
Thank you.
Where are the donors from?
From their country.
Why
Israel.
would they come? A recipient in need of an organ, together with their donor, leave Israel and come to Kenya for the procedure?
Oh, thank you. Because of the success rate. Our success rate is 99%. And it's known everywhere in this world. Yes.
Okay.
That's why I think even this country is coming up, and the international press are really trying to press us down.
But you see, according to what the ministry says, it is mentioned that information from Israeli sources themselves, from those that came to you, indicate that several kidney transplants involving trafficked foreign kidney donors had taken place specifically at your institutions.
No, that one I'm not aware, actually. I don't want to answer something which I'm not sure. That one I'm not aware. Yeah.
I'm going to go back to this question, and I'd like you to just make it a little bit clear so that we can, if possible, remove suspicion around this. What we are saying, essentially, according to what you're saying, is that Mediheal is so good at what it does when it comes to organ transplant that people from around the world go through a nephrological procedure. They do the match with they have the facilities in their countries to do this procedure. They are even finding a match. They get all of these things done in their own countries, and then for some reason decide to come to Eldoret to get the surgery done.
Thank you.
I want to understand why that happens in that manner. And I've asked where the donors are from, but you say, so they come in pairs for kidney transplants. They come along with their own donor. I want to understand again why.
Okay, thank you. There are tests and procedures and investigation which are primary, which can be done by a nephrologist in everywhere, by any doctor. But the transplantation is done by specific facilities. One of them is our facility. I'll speak only about our facility. Being having experts, good expert doctors. Number 2 is the infrastructure. And number 3 is the equipments that we have and modern theaters. Yes.
I want to ask you a question. The patient from Israel, together with their donor, would come to Mediheal Hospital based off your track record. But my question is, these are international patients that are coming into the country. In terms of you doing your due diligence to make sure that the donor is not being trafficked into your facility to donate their organs, do you go through such background checks, even extending it using the ministry, Foreign Affairs Ministry, or even contacting the Israeli embassy to just find out that both the patient and the donor are in Kenya, rightfully so, after getting clearance?
Okay, fine. Thank you so much. What we check from we follow the world standards. So what we check from them is like their passports, that their medical visa, and they come with the affidavits from their country and the letter from the authorities. So, and then they will come and follow here what is our procedures that we are following here. Yes, they will also sign from our side and they will confirm. Yes.
So now, how do we... the procedure is important for us to understand that the individuals who named Mediheal Group were very specific. They didn't say a hospital. They named the hospital. Why would somebody talk about receiving money to donate one of their organs? And also giving testimony that this happens often.
Thank you. Again, I will tell you that the patient that we are talking about, that he has said that he has received money, he has not mentioned Mediheal. He mentioned a specific name, an individual. Yes.
Oh, he did.
Okay.
No, he didn't mention Mediheal.
He didn't mention, he mentioned a name of somebody that he got money from.
Yes.
Okay. So what you're telling us this morning is that indeed you know of this patient.
A known person to me.
You know of a known person to you who gave the money?
Yeah, we don't know the facility. I'm not aware.
However, this patient who is the subject of this story,
yes,
you are aware that this patient had the procedure done at Mediheal.
Yes.
Okay?
Yes.
You say he came with his own donor, or rather his own recipient. You did all the tests. But today, the story, the way it came out, is that he fell ill later on. His mother then came to realize that his kidney had actually been removed, and And upon interrogation, he told his mother, actually, you know what? I went to hospital. I gave my kidney. They were supposed to give me 600,000 shillings. They only gave me 400,000. Would there be an individual connected with Mediheal, because you've admitted that you know of this patient and he came and had the procedure done at hospital? Would there be an individual outside of the hospital operation who would then give him money?
I'm not sure of that. Yes. But from the facility side, I'm sure that the services were rendered to this client.
Okay.
Yes.
And there are rates that are paid when somebody comes for this service. So they paid for the service, for the surgery.
The same rate.
The same rate?
Same rate.
Okay.
All the procedure and protocol were followed. All the documentation was done. We have the file. Yes. Thank you.
Okay.
Yeah.
So there is another query that has been raised by the ministry, and this is in terms of procedures that have been done at the hospital without a proper research, pretty much, on donor and recipient compatibility before the procedure is actually done. How would you respond to this allegation being said by the ministry, that you're doing these procedures without going through doing the due diligence to find out if the recipient and the donor are actually compatible? It has been raised.
Okay.
Which then brings the question in terms of this individual who went through the procedure later got ill. Do you go through 360 to find out that even after the procedure, the donor will remain running their lives as normal?
Dennis, I have to ask a question, please, if I may.
Yes.
The ministry is alleging that they do not do. You just read what it is that the ministry is alleging.
The ministry says that transplants are conducted despite poor donor-recipient compatibility.
No.
They have evidence to support this.
That is, they said they did the investigations, and this is what they found at the hospital.
That is what they say.
Yes.
For there to be incompatibility, there will be patients who are very unwell.
Yes.
Which is what was one of the triggers about this entire story, because one of the gentlemen was extremely unwell after the procedure. And this is why then the red flags were raised. That what essentially happened with him. Did you do any follow-up? Did this gentleman, who again is the subject of the story, come back to hospital and complain about feeling unwell post-procedure?
No.
So you've not seen him again?
No, I've not seen the patient coming back and complaining unless I do an investigation.
Is it the donor who was complaining, or was it the recipient?
The donor.
The donor was complaining.
Right. When you go through these procedures, there is an after-surgery process and care that you must be inducted into.
Yeah, we follow.
All that was followed.
Yes.
Because there are things you're told not to do for a period of time. There are things you should do. There's an entire process. So, your hospital went through this protocol and ensured that both the recipient and the donor were carefully taken through these processes, so they knew.
Yes.
Okay. When you take people through this process, is it something written which they can be given to go home with? Because if you simply speak, somebody can forget.
We have.
You do?
Yeah.
It is written down. So somebody has, it's documented. You know, we tell you, and then we give you the documentation. This is what you need to do after the procedure.
Yeah.
Okay. And in this case, that is what was done.
Yes.
Okay.
Okay. So,
and to answer you again, you are talking about a very sick patient which transplant were done. All the patient which the transplant have been done for the donor and the recipient, the clinical team ensures that the patient is fit before the transplant is done. Yeah, all these procedures which have been done.
And what about follow-up?
Follow-up, it's there.
How is that done?
Post-operative care is done.
Yes.
So our patient comes back to the clinic and then we make follow-up through call.
Did this particular patient come back to hospital and get a follow-up procedure done post-procedure? I asked this question before.
Yes.
Did he?
I don't have...
But you have information that other patients who've gone through a procedure will come back post-procedure and get a follow-up procedure done. Why would you not know about this one?
Maybe let me ask a different one. The follow-up question has been asked. You also said you follow up by calling. Did you call this patient? If they didn't come, did you call to find out why they haven't come?
Yeah, I'll check from our records. I think it was
so we don't know.
Yeah, I'll check. I'll check. I'll confirm that.
Whether he was followed.
Yes.
Okay. These allegations, these suspicions, these perceptions are quite serious. because we're dealing with a situation whereby, in as much as it is not illegal to donate your own organs, whether for pay or for goodwill, the question in terms of this has become a place whereby harvesting is taking place comes into question, and that's why the ministry is saying let them do an audit. Now, Maryline, would there be anything that would then require this kind of audit? Because it would be rare or strange for a ministry to say we want to do an audit based off of one case or based off of suspicion. And I ask the question again, why would the ministry want to take that route whereby of 8 facilities around the country, Mediheal Group is one of them?
Thank you. We are working very well with the ministry, and sometimes it is their routine check to come and do certain investigations, certain procedures.
Have they done it before?
Yes.
On what?
They came before regarding the kidney transplant, and then the finding was done. And it was okay.
What was the finding?
It was positive because we had 99%, and there were no any accusation about the trafficking. It was that it was the previous allegation again about trafficking. Oh, you remember that one for Shakaola? Yes.
Okay.
So the ministry has come, has done its investigations, and
like the routine,
the routine checkups.
Yeah.
You've passed with the flying colours.
Yeah, we work with the minister.
How many times a year do they have this checkup, these routine fact-finding processes?
It depends. Sometimes yearly.
Sometimes yearly.
Yeah.
So are there years when they do not come?
It's very rare.
It's rare.
Okay. That person will come.
So
if not directly, but someone will come.
Okay.
Is the hospital operating at the moment?
Not 100%. Yeah, currently the facility is operating with 5 departments.
5 departments.
Which are these?
Outpatient, maternity, IVF, that is test to babies, kidney transplant, orthopedics. Yes.
And what are the other departments that are not functioning?
Yeah, we have other departments which are not functional, like dental, ophthalmology. Yeah.
Why?
Yeah, we had some issues with financial constraint, like any other business kind of. Yeah.
Let me take you back to 2024, Maryline, where the Kenya Renal Association called for the immediate suspension of the operating licenses for Mediheal Group in Eldoret, and this was over alleged unethical kidney transplants performed at the facility. You're aware of this case?
It was not formally.
It was formal. And let me tell you some more. It was a statement. It was dated the 3rd of May. The association stated that they had received reports indicating an increasing trend of transplant commercialization and transplant tourism at the hospital, which is prohibited by law. According to the statement, in part, it is in direct violation of the World Health Organization resolutions, the Declaration of Istanbul, and Kenya's Health Act 01 of 2017. They went on to add that the evidence gathered over the past 2 years from donor and recipient testimonies have shown clear ethical breaches, including the exploitation of vulnerable donors. They therefore wanted the hospital's license to be suspended, as well as those of the medical personnel involved, calling for immediate disciplinary actions. I'll ask again, were you aware of this case?
Yeah, it was in the social media. What we normally follow as a facility, if the ministry or certain authorities come directly to us, when they come for their own investigation and they find it's okay, they will not terminate your license if you are doing the right thing. So, but what I can say that we remain committed to deliver ethical and high quality, compassionate health service to our patients in Kenya and beyond. Yeah.
Has the hospital ever reported any malpractice within its facilities? Anything that they felt or anything they observed did not follow the strict medical procedures that are required of them? No. Okay. So when we say that information, when they say alleged, did the allegations pan out? Did they actually determine whether these allegations were true?
Well, we don't get information in terms of whether they went ahead to find out. They asked that the DCI essentially follow up with some of these cases that were brought before them. My question remains whether the statement was actually brought to the attention of the hospital and not via social media.
Yeah, it was via social media, actually. So what I can also say that we are cooperating with all the relevant authorities to ensure transparency and accountability. So if the authorities come to us, we are accountable for what we have done as a facility, to answer them and provide the evidence that they need to the correct and to the correct authorities. To the right authorities.
There is the individual who was interviewed by the Deutsche Welle, and he has said what he said in terms of the monies that he was to receive. He went through the procedure. Now he is unwell. Has the hospital reached out to him to have a conversation and even understand why he is saying that he was given this money through the hospital? Have you reached out to him?
No, it's in process. There's a discussion about it. Yeah, we will reach out to him. Yes.
What would you reach out to him concerning? What would you want to ask him? What would you want to hear from him?
Yeah, our concern will be, we would like to know if someone is behind Mediheal Hospital, maybe tarnishing the name and destroying the facility. I'm not very sure what are the intentions here. Yeah.
Since this report broke out, and since you say that the renal unit is still operational, how many other procedures have you undertaken as a hospital since 2023 when this investigation started?
As I told you, hardly 450. Yeah, more
since
than 450. Since 2018.
2018.
Since 2018.
I'm asking from 2023 when this investigation started.
I have to check
what else does the renal unit do aside from conducting operations or transplants?
Yeah, they're responsible for dialysis patients.
They're responsible for dialysis patients. And with the dialysis patients, we have
done more than 1,000.
More than 1,000?
Not even 1,000, 10,000.
More than 10.
Yes.
And so
since the hospital
was started. And so even as we speak, there are patients who come to the hospital for the dialysis procedures.
Yeah, they do.
Okay. We can't ignore, allegations come and go. Some of them don't, hold water. But the repetitive nature of some of these things then, Maryline, requires some attention to be paid. Now, by your own admission, there are people who come from around the world to receive a kidney procedure. And of all the organ transplants, the kidney is the one that is happening at your renal unit. Obviously, that transplant is happening more than anything else. There are people who come in from different parts of the world. My question is, are all the individuals who come in for kidney transplants coming with their donors, or is there local donation of organs? And that would mean from Kenyans.
Thank you so much. Again, I'll repeat by saying the hospital is not responsible for providing the donor.
I'm asking, I need to know if the donors who provide the organs for transplant are Kenyans.
No.
There are no donors that provide.
In Kenya, we have patients from Kenya.
That's my question.
Yes.
Are there donors?
More than 300 actually.
So more than 300
are
donors.
Kenyans.
So if they're donor recipients, so then are we saying that the 300 donors are Kenyans as well?
Yeah.
They are.
Yes.
So 300 donors are Kenyans. How do you get them?
For the Kenyans or international patients?
The Kenyans.
Thank you. When the patient comes to the facility and the pre-workups have been done, so the counseling have been done by the nephrologist and the team, and the patient needs transplant to be done, the patient will be requested to come with possible donors. So he'll not even come with one. He can come with a brother, sister, mother, even further, and then the cross match will be done. The one which fits, there's some tests which are being done. I think next time we'll have a panel of doctors talking about it. So after that have been done, if you are found fit, then the transplant would be done with the person who matches the recipient.
Okay.
Yes.
So you don't have a list. You don't have like what you have a blood bank where you can go and donate blood. You don't have a list of people who say I'm a possible. You know how you have donor cards, and but if something were to happen to me, and next to my ID would be that I am a donor, I am an organ donor, meaning that you can take you can harvest my organs in the event of death, and my organs are in good. You don't have a list like that. So if somebody walks into the hospital today, and you say, well, this is clearly what your problem is, you go through the procedure, then you say, actually, bring the people that you believe would be possible organ donors. You don't have a list of recipients? No, you don't have a list of donors, for example?
No. We encourage the recipient to come with their own relatives. Yeah. We encourage them to come with their own relatives. Yes.
I think let me go to this specific matter of the young man who we know who he is. Are you able to confirm that the recipient was a Kenyan and that was related to him?
We have the document that both of them are Kenyans.
Are they related? Because you've just said you
No, they are
encourage
signed in the
recipients.
affidavit. There are things that we can verify as a facility because we are not working in the registry of persons, yes. But what you can tell me, this is my nephew. I'm not sure if this person is your nephew. So you have to swear an affidavit for that. So they swear an affidavit for that. Yes.
Okay.
Yeah.
Okay.
Because the far we can go, maybe you can know my mother and father, yeah, by birth certificate. But my sister, my brother, my cousin, it will be very difficult unless to swear affidavit. Yes.
But you see, I could also come in with a black man from America and say they're my cousin.
But
you know what I mean? So in terms of the hospital just doing due diligence in making sure that information that is given to you by both the donor and recipient is factual, does that lie in your purview? Do you go further extent, say, to confirm the same with police?
But why should we?
Or is it left?
Good question. Why should they?
Why not?
I'm asking, why should we go to police? And I cannot judge you by your color. I mean, in your family, maybe you are dark and brown, someone else is.
I think the overarching
my
question,
nephew.
I think the overarching question here in terms of is what methods you use, due diligence for verification of the individuals who are coming to you. Because remember, you've said, come with your, possible member who then could be your donor.
Yes.
So the overarching question here is what is actually being done in terms of due diligence to be very sure of exactly what happens here. And these issues of money then changing hands, you have heard them, have you not, Maryline?
Yeah, we have heard it.
You've heard them. Now, in order to disabuse yourselves from this particular notion, it's got to come out very clear in terms of what happens and how this procedure takes place. Do individuals indemnify themselves? Do they sign forms whereby they say this procedure is being done with my consent and etc.? Do those things happen?
Yes.
And after the fact, why would we have individuals who then come out and say that I have received money for this? How do you disabuse yourself from those rumors that you've obviously heard?
Thank you. I'll say what I mentioned earlier. The person who have accused Mediheal and saying that he took money, he didn't mention the name Mediheal. He mentioned an individual who is unknown to us.
Unknown to you?
Yes.
Okay.
So that's why the facility are taking action on investigating who is this unknown person who have given money to this client. The client have not mentioned, and the authorities still have right to go and investigate more. And we are willing to cooperate with the authorities, no problem. Yeah,
okay,
no problem.
All right. Of all the cases that you've dealt with, you said there's a 99% success rate. So
even if this client will be called now, in front of me. He will not say that he gave money to Mediheal.
Well, I mean, there could be reasons for that, of course. If one felt that they would be intimidated.
I am sure for that. I'm very sure, 100% sure.
You talk about a 99% success rate. So that means we have very few people who would actually come out later and complain. Is it possible that this individual who felt pain later on is in the 1% of individuals who then had a problem with the procedure?
For every procedure, there's a possibility of complication. Every procedure, not only kidney transplant, not only Mediheal, any other facility. Yes. Complication will always be there.
The ministry says, you talk about 99% success rate, but the ministry says you lack clinical morbidity and mortality reports. Is that the case? Why would they say that?
We have.
But the ministry says you do not, based off investigations that they did in 2023.
I'm not sure of that, but I'll check with the ministry. I think my boss will check with the ministry with that.
Okay.
Yeah. I've not gone through that process so much, but that is it.
Okay, so the question is, would the ministry document something which was not necessarily true? Are the ministry known to document information that is not true or can
just be alleged, for example?
Yes, and say this is because if you say that they do investigate and they do determine and they do look into all these processes that you have, given the sensitivity of these processes that we refer to as kidney transplants.
You see, there's a body that was formed, that is the Kenya Blood Transfusion and Transplant Services Secretariat and the Kenya Medical Practitioners and the Dentist Council, who did this investigation and came up with these recommendations and the fines that they...
Why I ask the question is, when they give you a report, the onus is on you to respond to their report. So if that was their report, what I was getting to, did Mediheal respond and say, this is what you have written, this is what you have documented, but our situation is this from our point of view?
Thank you. We have not received any formal communication from them. It's just this press which have been formed now, which came yesterday.
Oh, the things we're talking about.
But we are working well with the government.
You've never received, like what Dennis has just...
there?
You haven't received that formal communication.
No.
So essentially, the hospital and the management have not been informed that the ministry found them to be a little deficient in those specific areas. You do not have that documentation.
That was not from my desk, but I'll check with the board of directors if they have received.
I mean, even after this, the hospital did not go further to even request for findings because you are being investigated anyway. You did not try to find out what the report was.
If somebody makes an allegation about you, don't you think, and if it's adverse, if it's something that paints you in a negative light, should you then not ask them to give you the documentation? Let me ask a different question. If the hospital was to be communicated to, who would get the communication?
The chairman, maybe.
Okay. What would be your final communication in terms of moving forward and what is going to happen after you hear from the ministry, hear from all other interested parties? What's your message?
Thank you so much. My message is... I want to request the media, especially the international media, not to publish something they are not sure of. They have not gathered enough evidence, and they just post not only for Mediheal but for any other facility. And we are still committed, and we will cooperate with the authorities to make sure that the delivery of service at Mediheal will be provided as according to the guidelines of the government.
Maryline Limo is the Vice President of Operations at the Mediheal Group of Hospitals Eldoret, has been our guest this hour, trying to get through to some of these issues.
This is the Situation Room, the only way to start your day.